we're happy that you're listening to us. My name is Frank. And this afternoon, we have a wonderful people right here with us to talk about PPDC. So by the time you begin to talk, you get to understand what PPDC is all about and then the things that follow it. Right here, I have State Community Health Personnel, Mrs. Stella Eposa. Good afternoon. Thank you for joining us.
Thank you.
I also have a State Director, National Orientation Agency, Barrister Charles Ngoji. Thank you. Good afternoon.
Good afternoon.
And I have a Chairman, Anambra State Civil Society Network, ASCONET, Prince Chris as well. Thank you for joining.
Thank you. It's my pleasure.
All right. From my understanding, that what we are doing here is to, expose how effective citizens' engagement can help to curb the deficiencies encountered in executing projects, both in the health and the education sectors, and at the same time, help to provide a platform for accountability. Because in governance, when there's no accountability, then it can become anything is good. So we begin this very conversation by, first of all, let's try to understand what PPDC is all about. So someone has to tell us about PPDC and some of the work carried out in Anambra State. So let's begin from there.
Yeah, thank you. It's my pleasure to be here. PPDC, is a short form for Public and Private Development Center. It's a not-for-profit organization, non-governmental organization that came on board in the year 2003, and since then, in fact, their major vision is to see that public good works for the people in terms of true transparency and accountability. PPDC is working in the area majorly of citizen empowerment, through transparency and accountability, through reforms, and they have interest in community and social development. PPDC has worked in many other states. We are lucky this time they are in Anambra to help us look at especially service delivery. PPDC as an organization is interested in having the people's resources work for them appropriately, with integrity, in a transparent and accountable manner. And they are so much interested in efficient service delivery. They are coming to Anambra State. It's like to build on what we've been doing. The government of this state, through its people and stakeholders, have been doing a lot, going to the communities, lifting up the people, especially in the health sector. We have, the primary health care centers scattered all over the communities and the wards. In fact, there's been this, intervention of having makeover of most of the primary healthcare centers across board in